pumpkin weighs less than 1 pound.
Meg Lowry and Michelle Simmons have a lot in common. They're both in their mid-30s, good friends, and successful teachers at Odenville Elementary School.
There you go, good job.
But their bond reached a whole new level when they were both diagnosed with breast cancer.
As a wife and a mother, and knowing you have to raise 2 kids, the first thing you think is, how are we going to do this? So it's very scary.
Meg was diagnosed in September of 2015. The outpouring of support from her school and the community was powerful.
Within 1 week of my diagnosis, they had a t-shirt sale going. People were buying pink t-shirts everywhere. People were wearing pink. People were wearing things. We wear pink for Miss Lowry. I was seeing it in the car line. I was seeing it on Facebook. I was seeing it everywhere. And that's really what gives you the first initial big jump of power is, okay, I can do this. I've got all these people, they're gonna be my team. And we kind of just nicknamed it my Mega Fight team. And so, it was incredible.
Just 5 months later, a mammogram revealed a suspicious spot on Michelle's breast. Further tests confirmed it was a form of breast cancer.
I just remember I looked at my husband and he just looked white as a ghost. He couldn't believe it either. And then we both broke down. It was hard because those are words that you never want to hear.
Meg knew exactly where Michelle needed to go for treatment.
I immediately wanted her to go to my team at UAB, and that was the main thing. I was like, you've got to get in with them, and we were determined to get her an appointment and for her to see them because I think they're the best.
Like Meg, Michelle met with a team of UAB Breast Health Center physicians and the Comprehensive Cancer Center, who worked to develop a roadmap for her care.
UAB looked at my individual situation, my type of cancer, and suggested and knew exactly what needed to be done for me.
Michelle's school, family, and community again rallied around one of their own. Meg led a school-wide effort to support Michelle by organizing a pink party.
I had no clue, and I walked in the library and there were pink balloons and pink cake and even gifts that people were giving me for after I had my surgery.
The friends had mastectomy surgery just 2 days apart in April at UAB Hospital. Michelle's cancer was confined to a milk duct within her breast, so she was spared chemotherapy and radiation treatments. Meg's cancer, however, was still active at the time of her surgery. She needed chemo and radiation and recently completed her last treatment. She'll have reconstructive surgery in early 2017. Having been friends and co-workers for 13 years, their experience with cancer brought them even closer to each other and closer to their community.
It's amazing how when you go through something that's tragic and you feel like you're alone, you know that you've got a lot of people that are going to support you and love you, and people, like I said, that you don't even know.
I tell people a lot, it's not your grandmother's story anymore. Nowadays you can fight breast cancer, you can win, you can work a job and live your life and be a mom and be a wife and fight cancer and win all at the same time. And it's just so treatable, and the most important thing is to get the diagnosis so that you can get the help.